Why are your feet always cold? The surprising connection to your heart health. Hello, dear friends. How are you doing? Today, I'm going to share something really special with you. Sometimes our body sends us encrypted messages, like a whisper. Hey, pay attention to me. Well, constantly cold feet might be one of those whispers. Curious now, aren't you? Let's explore this mysterious connection together. Let's start with a story. Last month, Sarah came to our clinic. She's 52 years old, hardworking, full of life. Doctor, she said, I can't take off my winter socks anymore. Even in summer, my feet are ice cold. My family says, you've always been cold, but I sense something's not right. And that intuition, that's exactly what put Sarah on the right path. Because when we ran tests, we discovered she had a significant heart problem. She's now under treatment and doing so much better. But why does our body give us clues like this? The amazing language of our body. Imagine your body is like a huge city. Your heart is the most important power plant in this city. It beats about 100,000 times a day, working non-stop. With each beat, blood is pumped to every corner of your body. Along with blood comes oxygen, nutrients, and warmth. But what if this power plant gets a little tired? Or what if the roads start getting blocked? That's when the most distant neighborhoods of the city, your feet, become the first places affected. Makes sense, doesn't it? Your feet are at the furthest points from your heart. Pumping blood there requires extra effort. When there's even the slightest problem with your heart or blood vessels, your body makes a smart decision. Brain, kidneys, other vital organs first. Feet can wait. That's why cold feet are often the first alarm bell. The heart's whispers. Heart failure. Don't be scared when you hear heart failure. It doesn't mean your heart has stopped. It just means it can't pump as strongly as it used to. Maybe it's gotten a bit tired. Maybe its muscles have weakened. Now imagine a water pump. Normally, it easily pumps water to the third floor of your house. But what happens if the motor loses some power? Less water reaches the third floor. Pressure drops. That's similar to what happens with heart failure. When the heart can't pump strongly enough, the body acts strategically. It says, let's protect the most important organs. The brain must continue to be fed. The kidneys must keep working. But feet? The blood going to them can decrease a bit, and you start walking around with ice-cold feet. What's interesting is this. Many people think this is normal. They say, I've always been like this. But actually, their bodies have been screaming, help me, for years. There are other signs too. Shortness of breath, especially when climbing stairs. Getting tired quickly. Swelling in the ankles. Difficulty breathing at night. If you're experiencing several of these along with cold feet, I think a cardiology visit is essential. The silent blockage in our vessels. Now let's look at another scenario. Let's say your heart is quite strong, but the roads are blocked. How? Over the years, small deposits can form on the inner surface of our vessels. Cholesterol, fat particles, calcium. These create narrowing like the lime layer inside an old water pipe. We call this atherosclerosis. When this blockage happens, especially in leg and foot vessels, we call it peripheral artery disease. This disease is really sneaky. It develops slowly, there may be no symptoms for years. But one day, you realize your feet are always cold. Maybe you feel pain in your legs when walking. It goes away when you rest a bit. Maybe your toenails aren't growing as fast as they used to, or a small wound on your foot just won't heal. You know what? This disease is much more common in smokers. Smoking literally squeezes, narrows the vessels. People with diabetes, high blood pressure, and cholesterol problems are also at risk. And here's the even more serious part. If there's blockage in your foot vessels, most likely there's also blockage in your heart and brain vessels. So peripheral artery disease can actually be an indicator of a bigger problem. It means your risk of heart attack and stroke has increased. That's why you shouldn't dismiss cold feet as, oh, it's normal. Your feet's color-changing game. Now let's talk about a slightly different condition. Sometimes your feet don't just get cold, they change color too. First, they turn completely white, then take on a purplish tone, then bright red. We call this magical show Raynaud's syndrome. When you go out in the cold or when you're stressed, the blood vessels going to your toes overreact and constrict. When blood flow stops, that whiteness occurs. Then, when oxygen decreases, the bluish color begins. When you warm up and blood starts flowing again, that redness comes. Most of the time, Raynaud's is a harmless condition, but sometimes a more serious autoimmune disease or circulation problem can be hiding underneath. So if you experience these kinds of dramatic color changes, it should definitely be shown to a doctor. Blood pressure, too high or too low. There's something interesting about blood pressure. Both too low and too high can cause cold feet. Interesting, isn't it? With low blood pressure, the situation is simple. Because there isn't enough pressure, blood struggles to reach the feet. Feet get cold. With high blood pressure, things are a bit more complex. High pressure damages vessel walls for years. Vessels become stiff, lose their elasticity. Over time, these damaged vessels struggle to carry blood. Also, high blood pressure tires the heart muscle, thickens it, and can eventually lead to heart failure. Taking blood pressure measurements is very easy and important. You can even measure it at pharmacies. 120/80 are ideal values. If your blood pressure is consistently high or low, the cause needs to be investigated. Diabetes and the story of feet. Diabetes is really a serious threat to feet. It causes damage in two ways. First, high blood sugar damages vessel walls. Over the years, vessels narrow and stiffen. Foot vessels are especially affected by this. Result: insufficient blood flow and cold feet. Second, diabetes also damages nerves. We call this diabetic neuropathy. When nerves are damaged, strange things happen. Sometimes your feet feel ice cold, but they're actually at normal temperature. Sometimes you don't feel anything at all, which is more dangerous. Because when you have a wound, you don't notice it. Infection can develop. Diabetes patients need to pay close attention to foot care. They should check their feet every day, shouldn't ignore even a small cut, because with diabetes, both wound healing is slow and infection risk is high. What else could it be? Of course, not every cold foot is related to the heart or vessels. Our body is a complex system after all. If your thyroid gland is underactive, your metabolism slows down. Your body temperature drops, you feel cold everywhere, your feet become ice cold. We call this hypothyroidism. It's detected with a simple blood test, and treatment is very easy. Anemia can also cause cold feet. When you don't have enough blood cells, or they don't have enough iron, your body struggles to carry oxygen. When enough oxygen doesn't reach your feet, they get cold. Vitamin B12 deficiency can both cause anemia and lead to nerve damage. There can be numbness, tingling, and coldness in the feet. Nerve compressions due to herniated discs or back problems can also cause cold feet. Some medications, especially blood pressure medications like beta blockers, can reduce circulation in the feet. Recognize the warning signs. Now we've come to a very important section. In which situations should you say, okay, this isn't just cold feet, I definitely need to see a doctor? If along with your cold feet you feel a heaviness, tightness, pressure in your chest, go to the emergency room immediately. This could be a sign of a heart attack. If you have shortness of breath, especially if it gets worse when lying down, be careful. If you get tired very quickly, if you can't do things you used to be able to do, that's an alarm. If you have heart palpitations, if your heart beats irregularly, that's an important clue. If there's swelling in your feet or legs, if your shoes are hard to put on in the morning, these can be signs of fluid accumulation. If pain or cramps start in your legs when walking and go away when you stop, this is a symptom called claudication and suggests peripheral artery disease. If your feet change color, sometimes completely white, sometimes purplish, it should definitely be shown. If you have a wound on your feet and it hasn't healed for weeks, this is an indicator of a serious circulation problem. If your toenails have thickened, if there's deformity, if the color has changed, these are also clues of circulation and nerve problems. If you have dizziness, a feeling of fainting, this could be blood pressure or heart rhythm problems. If you have numbness, tingling, a feeling of being pricked with needles in your feet, nerve damage should be considered. What happens when you go to the doctor? When you go to the doctor, first you'll tell your story. How long have your feet been cold? Do you have other complaints? Is there heart disease in the family? Do you smoke? Do you have problems with sugar, blood pressure, cholesterol? What medications are you taking? Then your doctor will examine you. They'll look at the color of your feet, check their temperature by touch. They'll feel for your foot pulses, checking if there's a pulse in the arteries in your feet. They'll listen to your heart, listen to your lungs. They'll check if there's swelling in your legs. They'll probably order some tests. Blood tests will be done for sugar, cholesterol, thyroid hormones, anemia checks. With an EKG, your heart rhythm will be evaluated. With echocardiography, the heart ultrasound, your heart's pumping power and valves will be checked. If there's suspicion of vessel blockage, blood flow in leg and foot vessels will be evaluated with Doppler ultrasound. With a simple measurement called ankle brachial index, blood pressure in the foot and arm will be compared. If the foot pressure is significantly lower, this is a sign of blockage. If necessary, more detailed imaging like angiography can also be done. Protect your heart, warm your feet. Now we've come to the best part, things you can do, precautions you can take, because protecting your heart health is largely in your hands. If you smoke, please quit. I know it's not easy, but the damage smoking does to both the heart and vessels is incredible. When you quit smoking, your vessels immediately start to recover. The difference is noticed even in the first 24 hours. Get help, use nicotine patches, pills, support groups, but whatever you do, quit. Move, move, move. Walking is the simplest and most effective exercise. Walk briskly for at least 150 minutes a week. That's about 20 to 25 minutes a day. Swimming is great, cycling is nice, dancing is very fun. Whatever you do, be consistent. Exercise both strengthens the heart and improves blood circulation by developing leg muscles. Pay attention to your diet. Eat colorfully. Have vegetables at every meal. Consume fruits as snacks. Choose whole grain bread, bulgur, brown rice. Use olive oil. Eat fish at least twice a week, especially fatty fish like salmon, mackerel, and sardines are rich in omega-3. If you like nuts, eat about a handful a day. Stay away from salty foods, fried foods, processed foods. Reduce sugary drinks. Limit red meat consumption. Choose healthy snacks instead of junk food. Watch your weight. Extra pounds put serious strain on the heart. Even 5 pounds relieves the heart. But don't starve, eat healthy and balanced, lose weight slowly. Get your blood pressure, cholesterol, and sugar checked. Monitor these even once a year. If there's a problem, don't skip treatment. Take your medications regularly. Pay attention to stress management. Chronic stress damages the heart. Do deep breathing exercises, try meditation, do yoga, get hobbies, spend time with loved ones. Don't forget to laugh. Take care of your sleep. 7 to 8 hours of quality sleep every night is very important. If you have sleep apnea, get it treated. Quality sleep is one of the keys to heart health. Special care for your feet. Keep your feet warm, but be careful. Wear thick socks, but stay away from direct heat sources like electric blankets and hot water bottles. Especially if you have loss of sensitivity, there's a burn risk. Wear comfortable, wide shoes. Very tight or high-heeled shoes disrupt circulation. Let your shoes be made of breathable material. Check your feet every day. Look in a mirror, look at your soles too. When you see a small cut, blister, color change, don't neglect it. Pay attention to foot hygiene. Wash every day, but not with very hot water, with lukewarm water. Dry thoroughly, especially between the toes. Apply moisturizer, but not between the toes. Drink plenty of water. Dehydration thickens the blood and makes circulation difficult. Drink at least 8 to 10 glasses of water a day. Hopeful final words. Dear friends, we've come to the end of this long journey. I hope you've understood the story your feet are trying to tell you. Our body talks to us. It just asks us to listen. Cold feet are sometimes just cold feet, but sometimes it's also a loving warning your heart is sending you. It says, pay some attention to me, protect me. Receiving this message and taking action is in your hands. Early diagnosis changes everything. A timely checkup, a simple lifestyle change, a treatment taken when necessary can save your life. Remember, heart health means quality of life. Remember Sarah? She's much happier now. She's taking her medication regularly, doing her walks, changed her diet. Her feet are warm now too. But most importantly, she feels safe. Give yourself this opportunity too. If your feet are constantly cold and you're also experiencing some of the other symptoms I described in this article, please consult a doctor. Maybe nothing will come of it, and that will be great news. But maybe, thanks to early diagnosis, you'll prevent much more serious problems. Be your own health advocate. Ask questions, be curious, research. Listen to your body. It's really telling you very important things. Thank you so much for watching this video. If you found it useful, don't forget to like, comment, and subscribe to our channel. Share it with your loved ones too. Maybe there's information here they need to hear. See you in the next video. I wish you healthy, peaceful, warm days. Take good care of yourself. Protect your heart. Take care.